In this video, we will understand how does hearing work, what is hearing impairment, types of hearing loss, reasons for hearing loss, and most importantly, the ways in which hearing loss can be treated. Let's begin with understanding how hearing works. When someone speaks, the sound waves enter the ear and move down the ear, or auditory canal, what we call it in medical terms. In the auditory canal, they hit the eardrum, which then starts creating vibrations. These vibrations from the eardrum then pass to three bones. We call these three bones as the ossicles, and they are present in the middle ear. These ossicles act as a loudspeaker and amplify these vibrations. These amplified vibrations are then picked up by small hair-like cells called as stereocilia. These small hairs, or stereocilia, is present inside the cochlea. For your better understanding, cochlea is a hollow, spiral-shaped bone found inside the inner ear. It plays a very important role of auditory transduction, a process in which sound waves are converted into electrical impulses that human brain can interpret as individual frequencies of sound. So in the next step, these vibrations cause movement of cochlea, and the movement data is sent through the auditory nerve to the brain. The brain then processes the data, which a person with functional hearing will interpret as sound. And all this happens in a fraction of seconds. So this is how the hearing process works. Human body is a marvelous machinery, wherein complex tasks happen in a fraction of time. Types of hearing loss and treatment. Let's understand the difference between hearing loss and deafness. Hearing loss is a reduced ability to hear sounds. This can be cured by using various techniques to amplify the sound reaching your ears, whereas deafness occurs when a person cannot hear any sound, even when the sound is amplified. Sometimes, this is also referred to as profound deafness, wherein there is a total lack of hearing. Let's understand different kinds of hearing loss. There are essentially three kinds of hearing loss. First one is sensory neural hearing loss. Second type is conductive hearing loss. And finally, mixed hearing loss, which is a combination of both. Let's understand the reasons for each one of them, and how to detect it. Sensory neural hearing loss is the most common hearing loss, and it impacts 90% of the adult population. It happens when there is damage in the structure of your inner ear or auditory nerves. Sensory neural hearing loss of this type impacts the system that connects the inner ear with the brain. It can be mild to a complete hearing loss depending on the damage caused. It can either happen in one ear or both ears. In this case, the only way to identify is to go for a hearing test. However, following are some symptoms that you may feel if you have sensory neural hearing loss. Number 1. You find it difficult to hear what the other person is talking about when you are in a noisy environment. Number 2. You find it challenging to understand females or children's voices. Number 3. You find it difficult to hear high-pitched sounds. Number 4. You have a constant feeling of dizziness. Number 5. What you are hearing is unclear and muffled. Number 6. There is ringing in your ears. You can hear voices, but you cannot understand. All these are some of the key symptoms to identify that you have a sensory neural hearing loss. Although these symptoms are good indicators, it is always recommended to meet a specialist for a perfect diagnosis. A specialist uses the following techniques to diagnose sensory neural hearing loss. Physical examination, wherein the doctor looks for inflammation or earwax causing the hearing problem or any damage to the eardrums. Second is Weber's test. For this test, doctor uses a tuning fork. It is helpful in cases wherein there is a hearing loss in one of the ears. A 512 Hz tuning fork is struck and gently placed near the midline of the forehead. If the sound is lower in the affected ear, then it is a sensory neural hearing loss. Third is the RIN test. This is another test for identifying hearing loss. In this case, the doctor also uses a tuning fork but moves from behind the ears to the front of the ear canal. If you hear better when the tuning fork is in the front of the ear canal, it is sensory neural hearing loss. And finally, audiogram is done when the doctor expects you have a hearing loss. In this case, the patient is referred to an audiologist. An audiologist conducts a test using a unique headphone to understand the ear's reaction to a different level of sound frequencies. Let's understand the treatment options available for sensory neural hearing loss. Right now, there is no surgical option to treat sensory neural hearing loss. The most common options are hearing aids and cochlear implants to help you compensate for hearing loss. Let's understand each one of them in detail. First, and the most convenient treatment is hearing aids. Modern hearing aids can match specific hearing loss symptoms. For example, if you have problems hearing high-frequency sounds, a hearing aid can help reduce the frequency of these sounds without affecting other frequencies. The other option is a cochlear implant. A cochlear implant is very different from a hearing aid. Hearing aids amplify sounds so they may be detected by damaged ears, whereas cochlear implants bypass damaged portions of the ear and directly stimulate the auditory nerve. Signals generated by the implant are sent by way of the auditory nerve to the brain, which recognizes the signals as sound. Hearing through a cochlear implant is different from normal hearing and takes time to learn or relearn. However, it allows many people to recognize warning signals, understand other sounds in the environment, and also over the telephone. Let's understand what is conductive hearing loss, how to identify whether you have it, and also we will understand the diagnosis and treatments available. Your ear is made up of 3 parts: the outer, the middle, and the inner ear. A conductive hearing loss happens when sounds cannot get through the outer and middle ear. Fortunately, most cases of conductive hearing loss can be improved. Now let's understand some of the symptoms to detect conductive hearing loss. Number 1. And the most common symptom is muffled hearing. You feel as if the sound is unclear in most cases. Number 2. And another common symptom is sudden or steady loss of hearing. Number 3. Is stuffy sensation in the ear. You may experience a feeling of fullness or pressure in your ears. And some other common symptoms are dizziness, pain or tenderness in the ear. These symptoms are indicative, and for better diagnosis, it is always recommended to visit a specialist. Now let's understand some reasons for conductive hearing loss. Some of the most common reasons for conductive hearing loss include blockage of your ear canal, a hole in your eardrum, problems with 3 small bones in your ear, or fluid in the space between your eardrum and cochlea. Conductive hearing loss can be treated by either using a hearing aid as an assistive listening device or via surgery. It is best to consult an ENT specialist before deciding on the next course of action. Let's understand mixed hearing loss. Mixed hearing loss is elements of both conductive hearing loss and sensory neural hearing loss. This means there is damage to both the outer and inner ear. The outer ear cannot conduct sound properly to the inner ear, and the inner ear can't process the sound to be sent to the brain. Many people with mixed hearing loss experience sounds as very soft in volume and difficult to understand. The most typical causes of mixed hearing loss are the same as for conductive and sensory neural hearing loss, which includes genetic factors, aging, excessive noise, certain medications, birth conditions, tumors and diseases, and ear infections. There are 3 ways in which mixed hearing loss can be treated. Number 1. By using behind-the-ear style hearing aids. Their additional power helps to address severe to profound sensory neural hearing loss. Number 2. Cochlear implants are also an option that can be used to address the sensory neural aspect of mixed hearing loss. And thirdly, it may also require surgery, especially in the case of a tumor or blockage. We hope this video will help you make an informed decision when choosing the right and most appropriate hearing loss treatment. Please click on the link below to book your free consultation with an audiologist.